Welcome to the lecture on the mental health services system. So de facto service system components, according to the Surgeon General report in 1999, we've got specialty mental health sectors. These are services provided by specialized mental health professionals, specialized agencies, and offices. We've got general medical primary care sector, which involves general health professionals that deliver health services, including mental health, general acute care settings, and so forth. The human services sector is involved in professionals in human services, social welfare, criminal justice, education, religious or private charity type organizations. And then you have voluntary support networks. This involves self-help groups, advocacy, public education, communication and education for people facing mental health issues. Treatment settings in the mental health delivery system. You've got emergency services like hospitals, psychiatric emergency services, you got mobile crisis units and so forth. There's inpatient hospitalization, which would encompass state mental hospitals, private psychiatric facilities, psychiatric wing in general hospitals or VA hospital. And then for outpatient settings, you've got, again, hospitals, freestanding clinics, counseling programs, general practitioner practices, medical homes. For partial care kind of hospitalization stuff, you've got day hospitals, day treatment, day care, located in a variety of settings. And then for residential treatment facilities, you're looking at a specialized population. These are not hospitals, like group homes, therapeutic foster care, residential care for adolescents. You've also got other residential sites where they provide no or little mental health treatment, like nursing homes, prisons, homeless shelters, residential schools for children that are unsuccessful in typical schools. And then you have community support programs, and these would be programs that provide things like case management, a visiting nurse, and attendant care, or other professional support of community living. There are self-help groups, independent living centers, primary and secondary schools, social work or counseling services, pastoral counseling, other programs sponsored by religious organizations. Now, beyond formal mental health treatment settings, you've got services, case finding, and other. So settings with other missions that may offer services like prisons, homeless and domestic violence shelters, TANF work programs, universities. Settings that may contribute to case finding like police and fire departments, child protection services, juvenile or adult courts, military workplaces, animal control. And what about the oversight of these treatment settings, treatments, and the providers? You've got federal agencies like the CMS, SAMHSA, the U.S. Department of Justice. You also have state agencies like OMH, Protection and Advocacy Agencies, the Department of Health, State Education Department. And then you have private accrediting agencies like the Joint Commission, professional practice organizations, boards of medical specialties, and education accreditation, just like in social work, you would be looking at the CSWE. Now, there are 4 filters that affect entry to care. First, you've got where the different population groups go first for help, whether the source of help recognizes the psychiatric distress, symptoms, or conditions, whether there is a referral to a secondary source of care, such as a mental health specialist, whether the individual is accepted for admission into inpatient or other care. And this is where we get into issues with if there are rules associated with grant funding about who they can serve or not, or if it's insurance related. Okay, so facility auspice, the entity responsible for operations. So this is a graph from the Center for Behavioral Health Statistics and Quality on Substance Abuse and Mental Health Services Administration from 2017. And you can see that the majority of facilities fall under private nonprofit. Next would be private for-profit, and then regional district authority and so forth. Now, service settings of mental health treatment facilities, again from 2017, the majority of them are outpatient facilities, followed together closely behind residential and day treatment or partial hospitalization facilities. Now, facilities offering programs for persons with co-occurring or comorbid mental health and substance use disorders. The largest number would be psychiatric hospitals, followed by the Veterans Administration, and then multi-setting mental health facilities. And sometimes you can have those where it is focused just on mental health and substance abuse. Some are also medical and mental health conjoined facilities. So what are the percentage of visits to physicians' offices for primary mental health diagnoses from 2008? It was shown more than half, actually, were focused for psychiatry, just indicating this overall increase in the need for mental health care. Now, the number of clinically trained mental health professionals by discipline, what you're going to see here is the majority of it obviously is social work. So of the people that are providing mental health services, over 63% of them are social workers. Now, the occupational outlook for social workers is actually pretty good. Median pay as of 2017 was just under $48,000 a year, or about $23 per hour. And there's generally a need for an increase in services. According to this chart here, if you look at the first line, you're looking at an estimated rate increase of a need for over 100,000 more social workers across the different fields that social workers do, like child and family, healthcare, mental health, and so forth. Now, the projected demand for social workers, other human services and all occupations is pretty high. You can see the percent change in employment from an estimation of 2016 to 2026, that's another 6 years from now, is an overall increase of 16%. Now, the outlook for substance abuse, behavioral disorder, and mental health counselors. You can tell by the graph, again, looks like a rate increase of about 23% overall. Really what we're trying to say here is that this is a growing need within communities, and that we need more individuals in these services to provide care. And lastly, the estimated demand for mental health professionals. If we just step back and look at this on a national scale, you can tell by this graph with the darker, more orange and red colors indicating a significant need, the percentage of state population facing a shortage of mental health professionals. Those in red, it's up to 31% of the population don't have access to providers that they need for mental health services. And then in the orange, it's up to 25%. Those are large proportions of the population. That's the majority of the country. If you look at this, is going to need providers in order to help facilitate improvement in mental health.